Adam Thomas, osteopath from Osteopath Central, Sports and Spinal Rehab series. Just adding on to the headache, neck pain, migraine, whiplash video. We're going to add to that the jaw. This is also a standalone jaw video. We have a lot of jaw issues relating from overnight bruxism, chronic clenches, from trauma, athletic traumas, domestic traumas. Doesn't matter where trauma comes from, trauma is trauma. You have to understand that. Dentists are fantastic at fixing it and causing it. Love them. But also just anterior head carriage. You have to understand that when my posture is such that I collapse and I'm on a computer and my head is forward concentrating, my jaw now swings at a different angle to what it's designed for. And when we're chewing, swinging on a joint that's not designed to swing the way it does when your head's forward, collapsed, eventually it's going to create some problems. So postural awareness is key, but it is just a series of muscles like any other, and providing it's not acute, if it's acute, painful, red, hot, swollen, your osteopath told you not to overuse it, then there's a good chance that you don't overstretch it as well. So careful that this video is appropriate for you. If you're not quite sure, talk to your osteopath at Osteopath Central. Firstly, our muscles are predominantly clenches like a crocodile. Bam, we've got a big strong close, but we've got a very weak open. So predominantly all these muscles that create problems are clenches or alignment muscles, okay? Now, there's lots of detail in whether your mouth opens in a C shape or an S shape or is just straight off line, either way, or if there's an underbite or overbite. We're not gonna complicate this. They're a group of muscles and they need stretching, just like a hamstring or a calf, okay? So let's keep it simple. We're just gonna work on opening of the mouth or depression of the mandible under the maxilla. And just that little web there is designed perfectly to fit around your chin, okay? So just opening slowly, cupping that in, and you'll notice that we don't push straight down. You push straight down, you're gonna take your whole jaw off, okay? Comes down and around, swings, almost like a gate, okay? And so my pressure ends up coming in, down and around ever so gently, stretching out those long muscles that clench. Some of them come from the temple, temporalis, some are bigger and boxier, the masseter, and some are little internal ones that are to do with alignment and closing, like the pterygoid group, medial and lateral. So straight stretch is fine. We can also have teeth closed, deviation to one side or the other, and I use that little soft part just to help stretch out that side. That side, you can do the same stretch with a more wide open mouth. Left. All right. And they look almost identical, but they're completely different in their action, and you'll feel that when you have a turn. Now, because I can't talk and do that at the same time, you would actually hold those stretches for a minimum of 30 seconds unless it's painful beyond tolerance and you're not feeling it. If I'm stretching to my left, meaning I'm stretching my right hand side predominantly, there's also activity on the left. It's one bone, two joints. You'll feel compression or stretching depending on your problem and depending on it's a very complex nature of the joint. But keep in mind that if you're stretching this side, you can also be doing quite a lot of change on this side. So if you get pain here thinking you're stretching there, it's also a cue to have a chat to your osteopath and make sure that's okay for where you're at, for your problem, for your stage of healing. That's it. Straight opening, left, right in a closed manner, left, right in an open manner. Anything more than that is going to be detailed active rehabilitation. There's a bunch of really cool exercises we can do, but we do them on an individualized basis because it gets pretty complex pretty quickly and we need to work one-on-one for those. So come to the clinic and we'll check them out, particularly if it's about strengthening one side or dealing with a long-term imbalance. But for now, this video, the point of this is keep it simple. They're muscles, often they need stretching.